the News Channel 5 network, this is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris here with you on a Tuesday. We've got a good show on tap for you. It's something personal to me, and I guarantee you, if you're not dealing with something like this, you know someone who is. And what I'm talking about is hearing. All right, you know, in this business, you know, we have to wear these IFBs so the director can talk to me and all this. My volume is always cranked way up. In the old days, I used to listen to my Walkman headphones, and now there's earbuds everywhere, cranked too loud. I know the time is going to come when I'm going to need some type of hearing assistance, some type of hearing aid, and there have been all kinds of developments on that front. And we're going to talk about that this morning. We're going to open up the phone lines. As you see, we're talking about hearing health. You see this MorningLine sponsored this morning, and Ask an Expert with Middle Tennessee Audiology, a doctor of audiology, which I wasn't sure something like that really exists. But let me tell you, I'm glad they do. Noreen Gibbens is with us. Good morning, Noreen.
Good morning. Thank you.
Thanks for coming on. So just to clear, I'm going to ask the same question that maybe some of our viewers have right now. You're not a medical doctor.
No.
But a doctor of audiology is?
It is someone who is trained with at least an 8-year degree, 4 years undergrad, 4 years after undergrad, and it is a specializing in hearing healthcare, hearing diagnostic. We do a lot of balance work, hearing in children, cochlear implants. So it's somebody who's exposure to all aspects of hearing healthcare.
Okay, so you cover it all.
We cover it all.
Let's start, and we're going to get phone calls, I know, and the lines are open. If y'all have questions about hearing aids or hearing loss, we'll get to all that. But I'm going to give her a chance to lay it out. As we stand right now in society today, can you give me a snapshot of what percentage of the populace suffers some degree of hearing loss where they are going to need some type of assistance, like the type of thing that you provide?
Well, the one statistic that is very overwhelming is hearing loss is the third most chronic condition for people 65 and older.
Third most common
chronic condition. So it is a very common condition. People with diabetes are twice as likely to have hearing loss as those without. At least 20 to 30% of people exposed to noise in the workplace have some degree of measurable hearing loss. When you start to add the numbers, you include the music industry, you include other specialties, it becomes a very overwhelming number.
Depending on what you do. So, can we talk just, and this is great, good brief answers, but the causes. I mean, can there be a genetic component where some people just naturally are going to start losing their hearing aid, hearing health? I know for sure exposure to loud noises.
Correct.
What are the things that cause someone to start losing their hearing?
All of the things that you mentioned, genetics can certainly play a role in it, even for noise-induced hearing loss. If your father or grandfather worked in noise and had noise exposure or had hearing loss, you're more likely to develop it. We don't know exactly why.
That's odd.
There's a lot of medications that cause hearing loss that maybe is a hidden hearing loss, meaning we don't yet know exactly what the components are, but later on it shows up. We know for women who take a lot of ibuprofen, there's more hearing loss. There's anything that would affect your vascular health can affect your hearing, because the inner ear requires a good healthy blood supply. So those are things that affect hearing. It's usually slow and a very progressive sort of thing.
That's what I was thinking. If hearing loss is along the lines of, you hear vision is another issue for people as they age, cataract surgery and the like, and some people with time cataracts build and they don't know what they're missing until it's finally treated and they're like, wow. I'm wondering if it's the same with hearing, and how can you give me a threshold when someone maybe will notice and say to themselves, yes, I need to address it? How we all may lose a little hearing, maybe initially it's not that bad. Where does it become an issue?
Well, most people unfortunately wait about 7 to 10 years on average before they actually come in for testing.
So then they get tested and they get help and they're like, wow, I was missing this all this time?
Yes, and sometimes that's a good thing and sometimes that's a, please turn this down, that's a little too much thing. So, it's very hard for people to self-diagnose hearing loss. Unless someone is correcting them, it's different from vision. If I can't read something, I know, and I can get my readers out.
That's where it started for me.
Exactly, and so it's much easier to self-diagnose. With hearing loss, it's more subtle, and it's usually a family member saying something about the hearing. Spouses are very good judges of how well.
My wife would tell you that my issue is hearing, but now she'll say half the time, I'm not paying attention.
Yes.
And so since I'm not really focused, but other times I do find myself, and I was just doing this in the newsroom with our assignment editor, Emerald. She said something, and I find myself more often than not saying, what did you say? Mm-hmm. And I'm across the room, and I'm not thinking it's bad enough where it was completely out to lunch, but I couldn't make out all the words.
Well, that's truly what happens. We all get distracted. We're thinking about other things, and so there's attention that plays a very big role in how well we hear and understand. So we can hear something and not be attending to it.
Right.
That's going to create that what did you say sort of thing.
You're not focused, right.
And so one of the really big important things for families to do is to get the attention of the person they're communicating with. It's a two-way street. The person with the hearing problem, if they truly have one, should do something about it. But the person communicating with them needs to remember to get their attention. Don't talk from the other room. Right. No matter what we do with hearing aids, we're not going to be able to fix that problem. And that's a big one for families.
That makes great sense. Now, you and I talking here now, obviously I can hear you well. It's quiet in the studio.
Right.
If we were in a party setting right now, and there were people, not loud music, but just people chatting around us, and you were still next to me, it's almost like, and I know a lot of people have issues with this ambient noise creeping in, and I really find then I'd have to concentrate harder to hear you. Now, is that just normal, or is that perhaps a sign of hearing loss where I just can't hear you even though you're right next to me because of ambient noise?
It is an issue even in our late 20s and early 30s with normal hearing thresholds. There are signs that we lose our ability to understand in noisy environments. So that's still an issue no matter what the hearing level is. But as you get any degree of hearing loss, it becomes more of a problem because first of all, it's hard to control that environment. There's sound bouncing off the floor and the walls, ceilings, and that sort of thing. So we do what we can with hearing aids when we have directional microphones to pick up sound you're facing better than things to the side and behind you. That's really important. But that technology works best when the signal is right in front of you and the noise really is to the side and behind. In a party environment or some restaurants, you really have to look at the environment. Pick a less busy restaurant or a less busy time, quieter places. I tell my patients you're going to have to go to more expensive restaurants. They tend to be quieter. Don't go out as often maybe, and don't go during rush hour. It's a difficult time for all of us.
One other thing, there's so much I want to cover with you, and I know you just came back from a conference on noise-induced hearing loss. Bigger picture too, as people age too, is there a connection, do you believe, between hearing loss as you start all of a sudden succumbing and maybe just giving up on hearing and senility and Alzheimer's?
Unfortunately, yes. There was a 2010 study done at Johns Hopkins University where they decided to do a retrospective analysis, look back 10 years. They had all this, it's called NHANES data, this huge data pool, and they had hearing test results and cognitive test results on this huge number of people, and they decided to look at the association, or was there one, between hearing loss and dementia. And they found that with mild hearing loss, people were twice as likely to develop dementia. With moderate, it was 3 times, and severe, 5 times.
Why do you think that is? Is that because they're disengaging and their brains aren't working as much because they're not part of it, and that if they fix it, it might slow the progression?
Well, the good news is that it can be slowed when you treat the hearing loss, whether it be hearing aids or if there's some other treatment for it. That's the good news, and we really needed to hear that. You know, 2010, that was a pretty startling discovery. So there is some slowing or slowing in general of the dementia when you treat the hearing loss. Now, the reasons behind it, the lead researcher on this study believes it's kind of the multitasking, that when you're having trouble hearing, you're working so hard to concentrate that it's creating some sort of strain on our cognitive system that is not completely understood. There's also the question is, do they have similar etiologies, meaning does hearing loss tend to, just go along with dementia and all the things that we see with the brain in dementia? So it's hard to know for certain what the cause and effect is. But we do know that treating hearing loss is important.
All right, well, that's why we're talking about it this morning. So let's take a break. When we come back, we can take some phone calls. As you see, we're talking about hearing health. Obviously, Noreen here knows what she's talking about. So we'll take a break. We'll continue. There's a lot more to touch bases on. I want to get into some of these hearing aids, some of the help that is out there for folks. And that's the good news about all this. And like I said, I'm going to be dealing with this very soon myself, and I need to know what's out there. So the phone line's open, 737-7587. If you'd like to ask a question of our guest, if you're on hold, stay there. And I've got plenty of questions for her, too. We'll be back right after this.